Welcome to today's video lecture on writing a nursing care plan. As nurses, care planning is an essential skill that allows us to provide holistic and individualized care to our patients. In this lecture, we will discuss the key components and steps involved in creating an effective nursing care plan. So let's get started. Before we dive into the steps of writing a nursing care plan, let's first understand its purpose and importance. A nursing care plan is a written document that outlines the nursing interventions and goals to be achieved for a patient. It serves as a guide for healthcare providers to deliver consistent and quality care, promotes communication among the healthcare team, and ensures the patient's needs are met in a comprehensive manner. Now that we understand the purpose, let's move on to the steps involved in creating a nursing care plan. The first step in establishing a nursing care plan is a thorough assessment of the patient. This includes gathering subjective and objective data about the patient's health status, medical history, current condition, and identified nursing diagnoses. During the assessment, you should utilize various assessment tools, perform physical examinations, and interview the patient and their family to gather relevant information. The data collected will help identify the patient's needs and determine the appropriate nursing diagnosis. Before starting the assessment, it is important to ensure a comfortable and private environment for the patient. Gather the necessary assessment tools, such as a stethoscope, thermometer, blood pressure cuff, and penlight. Review the patient's medical history and any available documentation to familiarize yourself with their background. Introduce yourself to the patient and explain the purpose of the assessment. Establish a rapport and create a trusting environment by actively listening, maintaining eye contact, and showing empathy and respect. Inform the patient that all information shared will be kept confidential. Subjective data is information provided by the patient about their symptoms, feelings, and concerns. Use open-ended questions to allow the patient to express themselves fully. Explore their chief complaint, medical history, current medications, allergies, and lifestyle factors. Pay attention to the patient's emotional and psychosocial needs as well. Objective data involves the physical examination and observation of the patient. Begin by assessing vital signs, including temperature, pulse rate, respiratory rate, and blood pressure. Observe the patient's general appearance, skin color, and level of consciousness. Perform a systematic head-to-toe assessment, including inspection. Observe the patient's body for any abnormalities, such as skin lesions, wounds, or swelling. Palpation. Use your hands to assess the patient's body for temperature, texture, and any areas of tenderness or abnormality. Percussion. Tap lightly on the patient's body to assess underlying structures, such as the lungs or abdomen. Auscultation. Use a stethoscope to listen to the patient's heart, lungs, and abdominal sounds. After completing the assessment, take a moment to reflect on the data collected. Compare the findings to the patient's baseline and identify any areas of concern or potential nursing diagnosis. Collaborate with the healthcare team to develop an appropriate care plan based on your assessment. Once the assessment is complete, the nurse can move on to formulating nursing diagnoses. Nursing diagnoses are clinical judgments about the patient's response to actual or potential health problems. These diagnoses provide a framework for planning appropriate nursing interventions. Nursing diagnoses should be specific, measurable, attainable, realistic, and time-bound. They should address the patient's actual or potential problems and guide the nurse in providing individualized care. Actual nursing diagnoses describe existing health problems or conditions that require nursing interventions. Use the assessment data to identify the most relevant and appropriate nursing diagnoses. Consider the patient's physiological, psychological, and social needs. Actual nursing diagnoses are written in a three-part format: problem, etiology, cause or contributing factors, and defining characteristics, signs, and symptoms. For example, acute pain related to surgical incision as evidenced by patient rating pain as 8/10 on the pain scale. Planning is the next step in writing a nursing care plan. This involves setting goals and developing nursing interventions to address the identified nursing diagnoses. Goals should be specific, measurable, attainable, realistic, and time-bound, SMART. They provide a clear direction for the care to be provided and help evaluate the patient's progress. Nursing interventions are the actions and strategies implemented by the nurse to achieve the goals. These interventions should be evidence-based, individualized to the patient's needs, and consider the patient's preferences and resources available. The first step in nursing planning is to review the assessment data collected from the patient. Take into account both subjective and objective data, including the patient's medical history, current condition, and identified nursing diagnosis. Analyze the assessment data to identify the patient's strengths, limitations, and areas requiring interventions. This will help you determine the focus of the care plan and prioritize the patient's needs. Implementation is the phase where the nursing interventions are put into action. This involves executing the planned interventions, coordinating care with the healthcare team, and educating the patient and their family. During implementation, it is important for nurses to document their interventions, assess the patient's response, and make any necessary adjustments to the care plan. Before implementing nursing interventions, it is important to prepare yourself and the environment. Gather all the necessary equipment, supplies, and medications required for the interventions. Ensure that you have reviewed the patient's care plan, including the specific interventions and their rationale. Wash your hands and follow proper infection control protocols to maintain a safe environment for both you and the patient. The final step in writing a nursing care plan is evaluation. This involves assessing the patient's response to the implemented interventions and determining if the goals were met. Evaluation helps identify the effectiveness of the nursing care plan and guides further modifications if needed. It also provides an opportunity to reassess the patient's condition and adjust the care plan accordingly. Writing a nursing care plan is a critical skill that helps ensure comprehensive and individualized care for our patients. By following the steps of assessment, nursing diagnosis, planning, implementation, and evaluation, we can provide effective care and promote positive patient outcomes. That concludes our video lecture on how to write a nursing care plan. We hope you found this information helpful in your clinical practice. Thank you for watching, and remember to always prioritize the needs and well-being of your patients.